I have malar bags, festoons, as well as under eye bags. Can this be treated? Is laser or blepharoplasty best?
Thank you for your question. You submitted a photo and you stated in your question that you have malar bags and under eye bags, and you're asking is laser or blepharoplasty indicated? So, this question should first be answered by an explanation as to the causes of the under eye bags versus the malar bags. By understanding the causes, you can appreciate what your options are and what the solutions are and the basis for those solutions. So, practicing oculofacial cosmetic surgery for 20 years, I can tell you that it's been fairly straightforward to be able to treat the under eye bags, but on the other hand, treating malar bags has been one of the most challenging things that anyone who works in this area has had to deal with. So let's start with the under eye bags. The under eye bags are caused by something called lower eyelid fat prolapse. Lower eyelid fat prolapse is essentially an anatomic diagnosis where fat pockets that are around the lower lids behind the skin and a structure called the septum push forward and create a bulge. This tendency is basically most commonly from a genetic pattern. In fact, in my practice, I have operated on 3 generations in the same family with exactly that issue. So it tends to run in families. It's an anatomic issue. In order to treat lower eyelid fat prolapse, especially in younger people, we routinely do something called transconjunctival blepharoplasty. Transconjunctival blepharoplasty is an approach to addressing the fat pockets from the inside of the eyelids so we are able to avoid an external incision or scar. At the same time, we're able to accomplish this result and get the nice natural contour as if you never had eye bags. As far as malar bags are concerned, malar bags are the result of fluid that is backed up in this area. And that fluid can be caused by allergies, sinuses, smoking, and of course genetics. Since malar festoons or malar edema is due to fluid, surgical procedures are not really effective at making significant improvements. The patients who actually get the most dramatic improvements are the ones who have the worst festoons because their festoons look so bad that even when you directly excise them, they look better. So, that being said, I think that we can consider options such as what we do in our practice, where if you can treat underlying allergies, sinuses, or if you're a smoker to stop smoking, you will likely get some improvement of the malar edema or malar festoons. But in addition, we do employ some methods such as the use of fillers as well as platelet-rich plasma. Platelet-rich plasma, briefly, is a product from your own blood. What we do is we draw your blood, spin it, and we concentrate the healing factors. And the point of that is that when we do this in the area of the cheek and the malar festoons, we do get some improvement in skin quality as well as circulation, which can make the area look better. So as opposed to the fat pockets, which we can effectively significantly change, with malar edema or malar festoons, we look to try to improve the appearance, but we cannot eliminate them typically completely. In some older patients, we actually do get improvement when we do facelifting. Now, that being said, I think that your strategy should be to first do the transconjunctival blepharoplasty to reduce the fat pockets, and then see how this looks in the context of also the malar edema. in our practice, we usually find that getting rid of the bags makes a huge difference. And at the same time, there is a certain percentage of patients, particularly those in the more middle-aged facial aging changes, as volume loss, people in their 40s and 50s will be very happy about the bags being gone, but then will be concerned about the appearance of the fluid under in the cheek area. Many of those patients have benefit by adding volume to the cheeks to give them projection and to soften. So again, the concept is to soften the appearance so that it doesn't look so obvious. So at this point, I think you should go and investigate, meet with some qualified, experienced cosmetic surgeons and discuss your options and then move forward with the plan. I think that with the malar festoons, you may need some ongoing treatment rather than one surgical procedure that would allow you to be happy with the final result. So I hope that was helpful. I wish you the best of luck, and thank you for your question.